The breastfeeding journey is indeed a beautiful dance with a few tricky steps. Just like any dance, it requires practice, patience, and sometimes a bit of guidance. Breastfeeding is a beautiful and natural way to nourish your baby. It provides essential nutrients and antibodies that help protect your baby from illnesses. It creates a special bond between mother and child. This bond is not just physical but emotional, fostering a sense of security and love. However, it can sometimes feel tricky. Many mothers experience challenges such as latching difficulties, sore nipples, and concerns about milk supply. Many mothers face common challenges on their breastfeeding journey. These can include issues like engorgement, mastitis, and the baby's growth spurts affecting feeding patterns. Don't worry, you're not alone. There are many resources and communities available to support you. Understanding these common mistakes can help you avoid them and make breastfeeding a more enjoyable experience. Educating yourself is the first step towards a smoother journey. This guide will cover important topics for breastfeeding moms. From the basics of latching to advanced tips for maintaining milk supply, we've got you covered. We'll talk about nipple confusion, overfeeding, and pacifier use. These are common concerns that can affect your breastfeeding experience. We will also discuss the importance of avoiding smoking and alcohol. These substances can pass through breast milk and affect your baby's health. You'll learn about taking care of your breasts while breastfeeding. Proper care can prevent issues like cracked nipples and clogged ducts. Finally, we'll remind you about the amazing benefits of breastfeeding for both you and your baby. Breastfeeding can reduce the risk of certain diseases for both mother and child. Remember, every mother and baby are different. What works for one may not work for another, and that's perfectly okay. It's okay to ask for help if you need it. Seeking advice from professionals can make a significant difference. Lactation consultants and support groups can provide personalized guidance. They can offer tips and solutions tailored to your specific situation. This guide will be your roadmap as you navigate the world of breastfeeding. Think of it as your companion, offering support and information whenever you need it. Let's get started on this wonderful journey together. Embrace the experience, cherish the moments, and remember that you are doing an incredible job. Nipple confusion is a common hurdle for new mothers. This issue can be particularly stressful for those who are new to the experience of breastfeeding and bottle feeding. Understanding what nipple confusion is and how to manage it can make a significant difference in your breastfeeding journey. Nipple confusion happens when babies have trouble switching between a breast and a bottle. This can be due to the different techniques required for each feeding method. Babies might get used to the ease of bottle feeding and find it challenging to return to breastfeeding. It can also happen if they are given artificial nipples too early. Introducing pacifiers or bottle nipples before breastfeeding is well established can lead to this confusion. The baby might prefer the artificial nipple because it requires less effort to get milk. Babies use different sucking motions for breasts and bottles. When breastfeeding, babies need to latch onto the breast and use their tongue and jaw muscles to extract milk. In contrast, bottle feeding often requires a simpler sucking motion, which can be less demanding for the baby. This difference can lead to frustration for both you and your baby. The baby might cry or refuse to feed, and you might feel stressed and unsure of what to do. It's important to remember that this is a common issue, and there are ways to address it. To avoid nipple confusion, it's best to delay bottle feeding if possible. Experts recommend waiting until breastfeeding is well established before introducing a bottle. This usually means waiting until your baby is about 4 weeks old. Wait until your baby is about 4 weeks old and breastfeeding is well established. By this time, your baby will have learned how to latch properly and will be more adaptable to different feeding methods. If you do need to use a bottle, choose a slow flow nipple. Slow flow nipples are designed to mimic the flow of milk from the breast, encouraging your baby to use a similar sucking motion as they do on the breast. This type of nipple encourages your baby to use a similar sucking motion as they do on the breast. Remember, patience is key. It might take some time for your baby to get used to the bottle, so be patient and give them time to adjust. If your baby is struggling to latch, take a break and try again later. Sometimes both you and your baby need a moment to relax and reset. Trying again after a short break can often lead to better results. Skin-to-skin contact can also encourage your baby to latch naturally. Holding your baby close, with their skin against yours, can help them feel more secure and ready to feed. This contact can stimulate their natural feeding instincts. Hold your baby close and allow them to nurse when they show signs of hunger. Look for cues like rooting, sucking on their hands, or making sucking noises. Responding to these early hunger signs can make feeding more successful and less stressful for both of you. Remember, every baby is different, and it might take some time to find what works best for you and your little one. Overfeeding is something to watch out for. It can happen easily with bottle-fed babies. However, it's also possible to overfeed a breastfed baby. Signs of an overfed baby include spitting up frequently, being fussy after feedings, and having a lot of gas. They may also gain weight very quickly. The key to avoiding overfeeding is to feed your baby on demand. This means letting your baby nurse whenever they seem hungry. Don't worry about sticking to a strict schedule. Trust your baby's cues. They will let you know when they are full. If you are concerned about overfeeding, talk to your pediatrician. They can help you assess your baby's growth and ensure they are getting the right amount of milk. Pacifiers can be a helpful tool for soothing babies. They can provide comfort and help calm a fussy baby, giving parents a much-needed break. However, it's essential to understand the best practices for using pacifiers to ensure they benefit both you and your baby. However, it's important to use them carefully, especially in the early weeks of breastfeeding. During this critical period, your baby is learning how to latch and feed effectively, and introducing a pacifier too soon can disrupt this learning process. Introducing a pacifier too soon can interfere with breastfeeding. Babies might get confused between the pacifier and the nipple, leading to difficulties in breastfeeding. This is often referred to as nipple confusion, and it can make it harder for your baby to get the nutrition they need. It may also increase the risk of nipple confusion. Nipple confusion can result in your baby preferring the pacifier over the breast, which can lead to reduced milk intake and affect your milk supply. Experts recommend waiting until breastfeeding is well established before introducing a pacifier. This means ensuring that your baby is latching well, feeding effectively, and gaining weight appropriately. This is usually around 3 to 4 weeks of age. By this time, most babies have developed a good breastfeeding routine, and introducing a pacifier is less likely to cause issues. When you do introduce a pacifier, use it sparingly. It's best to offer it only after feedings or when your baby needs comfort, rather than as a first response to every cry. Offer it only after feedings or when your baby needs comfort. This approach helps ensure that your baby is still getting most of their comfort and nutrition from breastfeeding. Remember, breastfeeding provides more than just nutrition. It also offers comfort, security, and a unique bonding experience between you and your baby. The physical closeness and skin-to-skin contact during breastfeeding are crucial for your baby's emotional development. It offers comfort and bonding. These moments of closeness help build a strong emotional connection and can be incredibly soothing for both mother and baby. Avoid using a pacifier as a quick fix for every cry. It's important to understand the different reasons why your baby might be crying, such as hunger, discomfort, or the need for a diaper change. Pay attention to your baby's cues. Look for signs of hunger such as rooting or sucking on their hands, and respond accordingly. This will help you meet your baby's needs more effectively. They might be hungry, tired, or just need a cuddle. Sometimes, all your baby needs is the comfort of being held and rocked to sleep. By understanding and responding to your baby's cues, you can find the right balance between using a pacifier and providing the comfort and nutrition they need.